Welcome to Nightshift Horror. Before we check in tonight, don't forget to like, subscribe, and let me know where you're tuning in from. Now get comfortable. The night shift is about to begin.
Story 1. Reason for admission. Left blank. I could hear my own voice through the glass telling them I didn't remember signing anything. The intake coordinator kept her pen steady, moving down the form line by line, but when she reached the diagnosis field, she paused. Her hand hovered. Then she clicked the pen closed and told me the doctor would clarify everything after observation. I asked what I was being observed for. She smiled the way people smile when they're reading from a script they've recited too many times. Standard protocol, she said. The form went into a folder. The folder went into a drawer, and I was escorted to a room with a bed bolted to the floor. I admitted myself on a Tuesday afternoon in late September. The referral came from my primary care physician after I told her I hadn't been sleeping well. She suggested a voluntary stay. 3 to 5 days, she said, just to reset. I'd been under a lot of stress at work, and my partner had moved out 2 months earlier. Nothing dramatic, just the usual slow collapse of routine that makes you feel like you're operating at half capacity. I thought the structure might help. Regular meals, no distractions. A chance to talk to someone who wasn't obligated to care how I was doing. The intake process took 40 minutes. I answered questions about family history, substance use, prior hospitalizations. I handed over my phone, wallet, and keys. They gave me a plastic wristband with my name and a patient number, 8847. The coordinator reviewed the paperwork one more time before she filed it. I noticed the diagnosis line was still empty. I asked if that was normal. She said it would be updated after the attending psychiatrist completed my evaluation. I asked when that would happen. She said soon. The ward was smaller than I expected. 12 rooms along a single hallway. A common area with a television mounted high on the wall. A nurse's station with a plexiglass window. Everything was painted in soft, institutional beige, the kind of color that's designed not to provoke emotion. I was assigned to room 7. It had a narrow bed, a desk without drawers, and a window that looked out onto a courtyard no one was allowed to enter. The door locked from the outside. I met with a nurse that evening. She introduced herself as Holly and asked how I was feeling. I told her I was tired but otherwise fine. She made a note on her tablet and said dinner would be brought to my room. I asked if I'd be meeting with the psychiatrist soon. She said he'd be doing rounds in the morning. I asked if I could have something to read. She said she'd check with the team. The door closed with a soft magnetic click. Dinner arrived at 6 p.m. A tray with a sandwich, a cup of soup, and a carton of milk. No utensils. I ate with my hands and left the tray by the door. At 8 p.m., Holly returned to collect it. She asked how I was feeling. I told her I was still tired. She made another note and said I should try to get some rest. I asked if the lights could be dimmed. She said they were on a timer. They would go down automatically at 10 p.m. I lay in bed and stared at the ceiling. The fluorescent panel above me flickered intermittently, just enough to notice. I counted the seconds between flickers. 19, 23, 17. I tried to find a pattern but couldn't. Eventually, the lights dimmed to a low amber glow. I closed my eyes. I woke to the sound of footsteps in the hallway. It was still dark. I checked the window, but there was no clock. No way to tell what time it was. The footsteps stopped outside my door. I heard a soft beep, the sound of a key card being scanned, and then the door opened. A figure in scrubs stepped inside. They didn't turn on the light. They stood there for a moment, silhouetted against the hallway glow, and then they left. The door clicked shut. I lay still, heart pounding, and waited for my eyes to adjust. When I sat up, I noticed a new notation on the whiteboard near the door. It hadn't been there before. It read, "Patient cooperative. No distress observed." In the morning, Holly returned with breakfast. I asked her if anyone had entered my room during the night. She checked her tablet and said no. I told her I'd heard the door open. She said it was probably the night shift doing a wellness check. I asked why there was no record of it. She said those checks weren't always logged unless there was an incident. I asked what would constitute an incident. She didn't answer. She just collected the tray and reminded me that the psychiatrist would be by soon. Dr. Calloway arrived at 11 a.m. He was in his late 50s with graying hair and wire-rimmed glasses. He sat in the chair near the desk and opened a folder. I recognized it as the one from intake. He flipped through the pages slowly, making small humming sounds as he read. Finally, he looked up and asked how I was adjusting. I told him I was fine, but I was confused about why my intake form didn't list a reason for admission. He tilted his head slightly and said, "It does." I told him it didn't. He turned the folder toward me and pointed to the diagnosis line. It was filled in now. It read, "Adjustment disorder with depressed mood." I asked when that had been added. He said it had been there from the beginning. I told him I'd seen the form during intake and it was blank. He smiled the same way the coordinator had. He said sometimes patients misremember details during stressful transitions. He closed the folder and said he'd be monitoring my progress over the next few days. I asked how long I'd be staying. He said it depended on how I responded to the environment. I asked what that meant. He stood and said we'd talk more tomorrow. That afternoon, I was allowed into the common area. There were 3 other patients there. A woman in her 30s sat by the window staring at the courtyard. A man in his 20s paced slowly near the television. An older man sat at one of the tables folding and unfolding a napkin. No one spoke. I sat down near the television and tried to focus on the news. The volume was low, barely audible. The closed captions were on, but they lagged behind the audio by several seconds. I found myself reading words that hadn't been spoken yet. At dinner, Holly brought my tray and asked how my day had been. I told her it was uneventful. She made a note and said that was good. I asked if I could make a phone call. She said phone privileges were granted after the first evaluation period. I asked how long that was. She said it varied. I asked if I could at least know what day it was. She paused, then said it was Thursday. I told her I'd arrived on a Tuesday. She said time moved differently here. Then she left. I began keeping track of the days by marking the wall near my bed with my fingernail. Small, faint scratches that I could only see in certain light. By my count, I'd been there for 6 days when Dr. Calloway returned. He asked how I was feeling. I told him I was ready to leave. He nodded thoughtfully and said we'd need to review my progress first. He opened the folder. The diagnosis line had changed. It now read, "Unspecified anxiety disorder." I asked him why it was different. He said it had been updated to reflect my current presentation. I told him I hadn't presented with anxiety. He said my chart indicated otherwise. He turned the folder toward me. There were notes I didn't recognize. Observations about restlessness, difficulty sleeping, irritability. I told him those weren't accurate. He said it was common for patients to have limited insight into their own behavior. He closed the folder and said he'd check in again soon. The next time I saw the folder, the diagnosis had changed again. Depressive episode, moderate, then adjustment disorder, unspecified, then mood disorder, not otherwise specified. Each time, Dr. Calloway assured me it was part of the standard diagnostic process. Each time, I insisted I didn't have the symptoms he described. Each time, he made a note about my lack of insight. I stopped asking questions. I stopped marking the wall. I ate my meals and sat in the common area and returned to my room when I was told to. Holly continued to ask how I was feeling. I told her I was fine. She said that was good. The other patients cycled in and out. New faces appeared, old ones vanished. No one explained where they went. One morning I woke to find the diagnosis line completely blank again. I stared at it for a long time, trying to understand. When Dr. Calloway arrived, I asked him what it meant. He looked at the folder, then at me and said, "It means we're still determining the most accurate description." I asked how long that would take. He said it was difficult to say. I asked if I could leave. He said not yet. I asked why. He closed the folder and said, "Because we haven't finished observing you. I'm still here. The intake form is still in that folder. The diagnosis line changes every few days. Sometimes it's filled in. Sometimes it's blank. Sometimes it lists conditions I've never heard of. Dr. Calloway tells me we're making progress. Holly tells me I'm doing well. The door still locks from the outside. I've stopped asking when I'll be discharged. I've stopped asking what I'm being treated for. The answer is always the same. They're observing me. They're updating my file. They're determining the most accurate description. But I've started to notice something else. In the common area, when new patients arrive, they ask the same questions I asked. They want to know why their intake forms are incomplete. They want to know when they'll be released. And the staff gives them the same answers, the same smiles, the same reassurances. And sometimes, late at night, I hear the door to my room open. I hear the soft beep of a key card. I hear footsteps. And in the morning, there's always a new notation on the whiteboard. Always something I don't remember doing. Always something that justifies keeping me a little longer. I don't think the form will ever be complete. I think the diagnosis changes because they need it to. Because a patient without a clear reason for admission is a patient who should be released. And they can't release someone they're still observing. So they keep writing, and I keep staying. And the door keeps locking from the outside. Some forms are never meant to be finished. They're meant to justify why you're still holding the pen. Story 2. The observation window. They told me the window was for my safety, that someone would always be nearby, but that I wouldn't be disturbed unless necessary. I asked who would be watching. The nurse, a soft-spoken woman named Kim, said it was protocol for patients under continuous observation. She said it as if continuous observation were a comfort, as if being seen without being acknowledged were a form of care. I looked at the darkened glass and saw only my own reflection. She left without explaining further. The door locked. The window remained. I was admitted under a 72-hour hold after what my doctor called an acute dissociative episode. I'd been found standing in the parking lot of a grocery store at 3 a.m, unable to remember how I'd gotten there or why I was holding a carton of eggs. The EMTs were kind. They wrapped me in a blanket and asked if I wanted to call anyone. I said no. I didn't know who I would call. My phone had 17 missed calls from a number I didn't recognize. I didn't answer. The intake process was brief. They took my clothes, my phone, my shoes. They gave me scrubs and socks with rubber grips on the soles. I was escorted to a room on the acute wing. It was smaller than I expected. A bed, a desk, a chair bolted to the floor. And the window. It took up most of the far wall, a wide panel of dark reflective glass. I asked the intake coordinator what it was for. She said it was standard for patients requiring close monitoring. I asked what I was being monitored for. She said the doctor would explain everything in the morning. I sat on the edge of the bed and stared at the window. I couldn't see through it, but I knew someone could see through to me. I stood and walked closer, pressing my hand against the glass. It was cold. I leaned in until my breath fogged the surface. I whispered, "Can you hear me?" There was no response. I sat back down. The first night, I didn't sleep. I couldn't shake the feeling of being observed. Every time I moved, I imagined someone on the other side making a note. Patient shifted position at 2:14 a.m. Patient stared at the ceiling for 11 minutes. Patient appeared distressed. I wondered how they defined distress. I wondered if it mattered whether I was actually distressed or just looked that way. In the morning, Kim returned with breakfast. She asked how I'd slept. I told her I hadn't. She made a note on her tablet and said that was understandable. I asked if anyone had been watching me through the window overnight. She said someone was always nearby. I asked if they'd seen anything concerning. She said no. I asked if they'd logged anything at all. She paused, then said, "Only routine observations." Dr. Gaines arrived at 10 a.m. He was younger than I expected, with dark circles under his eyes that suggested he'd worked the night shift. He sat in the chair and opened a folder. I asked him why I was under continuous observation. He said it was a precaution following my episode. I asked how long it would last. He said it depended on my stability. I asked how stability was measured. He said, "By how you respond to being here." I told him I felt fine. He made a note. I told him I didn't remember what had happened in the parking lot, but that I wasn't a danger to myself or anyone else. He made another note. I asked if he believed me. He said belief wasn't the issue. He said the observation period would help establish a baseline. I asked what that meant. He said it meant they needed to see how I behaved when I thought no one was watching. But someone was always watching. I started testing it. Small movements at first. I would stand and walk to the window. I would wave. I would press my face against the glass. I would mouth words. No one ever responded. No one ever knocked. No one ever opened the door to tell me to stop. But the next time Kim came by, she would mention something. "You seemed restless last night." Or, "You were standing for a long time. Is something bothering you?" I would ask how she knew. She would say it was in the notes. I asked to see the notes. She said that wasn't part of protocol. I asked who was writing them. She said it was part of the observation team. I asked how many people were on the team. She said it varied. I asked if I could meet them. She said that wasn't necessary. I asked why not. She didn't answer. She just collected my breakfast tray and left. I started keeping my own log. I didn't have paper, so I used the wall. Small marks near the baseboard where no one would see. I marked every time I felt the presence behind the glass. Every time I thought I saw movement in the reflection. Every time I heard a sound that suggested someone was there. By the third day, I had 47 marks. Dr. Gaines returned on the fourth day. He asked how I was feeling. I told him I wanted the observation to stop. He asked why. I said it was making me more anxious than I'd been before I arrived. He said that was a common response. I asked if that meant it would end soon. He said no. He said my anxiety was something we needed to monitor. I told him I'd been watching the window. He asked what I'd seen. I said nothing. I said that was the problem. He made a note. I asked what he was writing. He said, "Birdsome. Patient reports visual focus on observation window. Possible preoccupation with being watched." I told him that wasn't what I said. He said it was a clinical interpretation. I asked if I could see his notes. He said no. He said it would interfere with the therapeutic process. That night I woke to the sound of a chair scraping against the floor. It came from the other side of the window. I sat up and stared into the dark glass. I couldn't see anything, but I knew someone was there. I walked to the window and pressed both hands against it. I said, "I know you're there." The scraping stopped. I waited. Nothing. I went back to bed. In the morning, Kim brought my breakfast and asked if I'd slept. I told her I'd heard something during the night. She checked her tablet and said there was no record of any disturbance. I told her the sound came from the observation room. She said the observation room was empty at night. I asked how I was being observed if no one was there. She said the monitoring was automated. I asked what that meant. She said cameras and sensors tracked movement and vital signs. I asked why there was a window if no one was watching. She said it was for emergencies. I asked what kind of emergencies. She didn't answer. I stopped trusting the reflections. I started noticing inconsistencies. My movements in the glass didn't always match what I was doing. Once I raised my right hand and the reflection raised its left. I blinked and the reflection stared. I turned away and the reflection stayed facing forward. I told Dr. Gaines. He said it was likely a trick of the light. I told him it happened multiple times. He said stress could distort perception. I asked if he thought I was imagining it. He said he thought I was focusing on the wrong things, but the notes kept coming. Kim would mention things I hadn't done. You were pacing for 20 minutes last night. I hadn't paced. You were speaking to yourself at 4 a.m. I hadn't spoken. You appeared distressed around 6:15. I hadn't been awake. I started asking her to show me the recordings. She said recordings weren't reviewed unless there was an incident. I asked what constituted an incident. She said anything that required intervention. I asked if my questioning counted as an incident. She said no, but the notes kept coming. On the 7th day I saw it, a figure behind the glass, just for a moment, a silhouette against a faint light. I stood and walked to the window. The figure didn't move. I knocked on the glass. The figure remained still. I knocked again, harder. The figure tilted its head. I shouted, "I can see you!" The figure stepped back into the darkness. When Kim arrived, I told her what I'd seen. She said there was no one in the observation room. I said I saw someone. She said it must have been a reflection. I said it wasn't. She made a note. I asked what she was writing. She said, "Patient reports visual hallucination, observation window." Dr. Gaines arrived an hour later. He said my observation period was being extended. I asked why. He said I was exhibiting signs of perceptual disturbance. I told him I wasn't hallucinating. He said that was often how it felt. I asked to be moved to a different room. He said the observation window was necessary for my care. I asked what I was being cared for. He said, "We're still determining that." I stopped looking at the window. I sat with my back to it and stared at the door. But I could still feel it, the presence, the weight of being watched. And the notes continued. Patient avoids observation window, possible awareness of monitoring. I'm still here. The 72-hour hold has become indefinite. Dr. Gaines says I'm not ready to leave. Kim says I'm making progress, but the window is still there, and I know now that it doesn't matter whether anyone is behind it. The notes are written before I move. The observations are logged before I act. They're not watching me, they're anticipating me, and sometimes late at night I see my reflection in the glass. It moves before I do, it blinks when I keep my eyes open, it smiles when I'm not smiling. I think the observation period never ends. I think it's not about seeing what I'll do. It's about deciding what I've already done. Some windows are meant to reflect what you were, not what you are. Story 3. Group Therapy, Session 14. I've been introducing myself the same way for 3 months. Every Tuesday at 2 p.m., the 6 of us sit in a circle in the West Wing conference room. And when the facilitator nods at me, I say, "My name is Evan. I've been here for 4 weeks. I'm working on managing intrusive thoughts." The others go next. Same names, same reasons, same phrasing, word for word, week after week. Until the session when I opened my mouth to speak and someone else said my introduction for me. The facilitator marked it as progress in her notes. I didn't correct her. I wasn't sure I could. Group therapy was recommended during my second week on the ward. I'd been admitted after a prolonged period of depersonalization. My therapist called it derealization. My psychiatrist called it dissociation. And I called it feeling like I was watching my life happen to someone else. The medication helped, but Dr. Renner said socialization was just as important. He said hearing other patients' experiences would help me feel less isolated. He said structure would help rebuild my sense of continuity. I agreed because I didn't know what else to do. The group met in a room with large windows that overlooked the hospital's north lawn. There were 6 chairs arranged in a circle. No table, no clock. Just the chairs, the facilitator, and a whiteboard on the wall that listed the session number. When I arrived for the first time, it read, Session 7. The facilitator was a woman in her early 40s named Rebecca. She had a calm, rehearsed way of speaking, the kind of voice that suggested she'd run these sessions 100 times before. She welcomed me and gestured to an empty chair. I sat. She introduced the others. "This is Pauline," she said, nodding to a woman in her 60s with silver hair and a quilted cardigan. Pauline smiled but didn't speak. "This is Aaron," she continued, indicating a man in his late 20s with a patchy beard and wire-rimmed glasses. Aaron nodded once. "This is Laura." Laura was younger, maybe early 20s, with dark circles under her eyes and hands that never stopped moving. "This is Colin." Colin was older, maybe mid-50s, with a blank expression and a hospital bracelet that looked worn from months of wear. "And this is Dennis." Dennis was the youngest, early 30s, with a shaved head and a posture that suggested he'd been sitting in that chair for a very long time. Rebecca explained the format. Each session, we would take turns introducing ourselves. We would state our name, how long we'd been on the ward, and what we were working on. Then we would share something we'd noticed about our week. The goal was to build self-awareness and mutual support. She asked if I had any questions. I didn't. Pauline went first. "My name is Pauline. I've been here for 6 weeks. I'm working on processing grief." Aaron went next. "My name is Aaron. I've been here for 9 weeks. I'm working on managing paranoia." Laura followed. "My name is Laura. I've been here for 11 weeks. I'm working on stabilizing my mood." Colin said, "My name is Colin. I've been here for 13 weeks. I'm working on improving my memory." Dennis finished. "My name is Dennis. I've been here for 15 weeks. I'm working on reducing compulsive behaviors." Then it was my turn. I said, "My name is Evan. I've been here for 2 weeks. I'm working on managing intrusive thoughts." Rebecca made a note on her clipboard and said, "Thank you, Evan. Welcome to the group." The rest of the session was uneventful. We talked about small things, meals, sleep, the courtyard. No one said anything particularly revealing. No one asked follow-up questions. When the session ended, Rebecca reminded us that the next meeting would be the following Tuesday. I returned to my room and didn't think much about it. The following week, the whiteboard read, Session 8. We introduced ourselves again. Pauline said the same thing. Aaron said the same thing. Laura, Colin, Dennis, all the same, word for word. I noticed but didn't mention it. I assumed it was part of the format, a way to reinforce consistency. By session 10, I started keeping track. I wrote down what each person said, and the following week I checked. Identical. Not similar. Identical. Same phrasing, same pauses, same inflection. I asked Rebecca if we were supposed to update our introductions as we progressed. She said, "You're welcome to if you feel it's helpful." I asked if anyone else had. She said, "Most people find comfort in consistency." I looked around the circle. No one reacted. I let it go. Session 11, Session 12, Session 13. The introductions never changed. Pauline had been there for 6 weeks for 13 weeks. Aaron had been managing paranoia since before I arrived. Laura's mood had been stabilizing for 3 months. I asked Dr. Renner if patients were typically in group therapy for that long. He said it depended on the individual. I asked if it was normal for them to repeat the same introduction every week. He said repetition could be grounding. I asked if it was grounding or scripted. He said he didn't understand the distinction. Session 14. The whiteboard was updated. We took our seats. Rebecca welcomed us and asked who wanted to start. Pauline raised her hand. My name is Pauline. I've been here for 6 weeks. I'm working on processing grief. Aaron went next. My name is Aaron. I've been here for 9 weeks. I'm working on managing paranoia. Laura followed. My name is Laura. I've been here for 11 weeks. I'm working on stabilizing my mood. Colin said, My name is Colin. I've been here for 13 weeks. I'm working on improving my memory. Dennis said, My name is Dennis. I've been here for 15 weeks. I'm working on reducing compulsive behaviors. Then it was my turn. I opened my mouth to speak, and Aaron said, My name is Evan. I've been here for 4 weeks. I'm working on managing intrusive thoughts. I froze. I looked at Aaron. He was staring at Rebecca, waiting for her to respond. I looked at the others. No one reacted. No one looked confused. Rebecca made a note on her clipboard and said, Thank you, Evan. I said, That wasn't me. Rebecca looked up. I'm sorry? I said, I didn't say that. Aaron said it. She glanced at Aaron, then back at me. Aaron already introduced himself. I said, No. He said my introduction. He said my name. Aaron looked at me with the same blank expression he always had. I said my name. I said, You said Evan. He said, I said Aaron. I looked at the others. Pauline smiled gently. Laura's hands kept moving. Colin stared at the floor. Dennis didn't blink. Rebecca said, Evan, it's common to feel disoriented during group. If you need a moment, we can pause. I said, I don't need a moment. I need to know why he said my introduction. She made another note. Let's move forward. Evan, would you like to share something about your week? I didn't answer. I sat in silence for the rest of the session. When it ended, Rebecca reminded us that next week would be session 15. I left without speaking to anyone. I went to Dr. Renner and told him what happened. He listened, nodded, and said, Group dynamics can be challenging. Sometimes we project our own anxieties onto others. I told him I wasn't projecting. I told him Aaron had said my introduction. He said, Are you certain? I said, Yes. He made a note and said, We'll monitor how you're responding to the group setting. Session 15. I sat in my chair and waited. Rebecca asked who wanted to start. Pauline went first. Same introduction. Aaron went next. Same introduction. Laura, Colin, Dennis, all the same. Then it was my turn. I didn't speak. I waited to see if someone else would. Laura said, My name is Evan. I've been here for 4 weeks. I'm working on managing intrusive thoughts. Rebecca said, Thank you, Evan. I stood up. That's not my voice. That's Laura. Rebecca said, Evan, please sit down. I said, She said my introduction. Laura looked at me with wide, unblinking eyes. I said my name. I turned to Rebecca. She said, Evan. I heard her. Rebecca said, You're experiencing confusion. This is noted. Please sit down so we can continue. I sat. The session continued. No one acknowledged what had happened. Session 16. Colin said my introduction. Session 17. Dennis. Session 18. Pauline. Every week someone else spoke my words. Every week Rebecca recorded it as if I had spoken. Every week the others looked at me as if I were the one disrupting the group. I stopped going. I told Dr. Renner I didn't want to attend anymore. He said group therapy was part of my treatment plan. I said it was making me worse. He said that was a sign it was working. I asked how that made sense. He said, "You're confronting discomfort, that's progress." I was required to return for session 19. I sat in my chair and said nothing. Rebecca asked if I wanted to introduce myself. I shook my head. She said, "That's all right. We can go around and let others share today." Pauline started, but instead of her usual introduction, she said, "My name is Evan. I've been here for 4 weeks. I'm working on managing intrusive thoughts." Aaron said, "My name is Evan. I've been here for 4 weeks. I'm working on managing intrusive thoughts." Laura said it. Colin said it. Dennis said it. Rebecca looked at me and said, Evan, it seems the group has adopted your introduction as a shared statement. This is a significant moment of cohesion." I said, "Why are they saying my name?" She said, "They're expressing solidarity. You've become a touchstone for the group." I said, "I don't want to be a touchstone." She said, "It's not always about what we want. It's about what the group needs." I looked around the circle. All 5 of them stared at me with the same expression. Blank. Waiting. I asked, "What happens when the group doesn't need me anymore?" Rebecca smiled. "Then we'll update the introductions." I didn't go back after that, but I heard from another patient that the group still meets, that they still introduce themselves the same way, that they all say my name now, that Rebecca marks it as progress. I'm still on the ward. I don't know how long I've been here. I don't attend group anymore, but sometimes late at night I hear voices from the West Wing, 6 voices speaking in unison, saying my name, saying my reason for being here, saying I've been here for 4 weeks, over and over. I think the introductions were never about us. They were about becoming us. Some sessions don't end. They just absorb who you were and continue without you. Story 4, Personal Effects Inventory. The intake coordinator handed me a clipboard with a list of items I'd allegedly brought with me. I scanned the entries: wallet, phone, keys, wedding ring. I stopped at the last one. I told her I wasn't married. She looked at the list again, tapped her pen against the line and said, "It's right here, gold band engraved. You handed it to the EMT." I told her I didn't own a wedding ring. She said the inventory was completed on arrival and signed by me. She turned the clipboard around. The signature at the bottom looked exactly like mine. I asked to see the ring. She said personal effects would be returned upon discharge. I asked when that would be. She said it depended on my progress. I signed the form without reading the rest of it. I didn't realize until later that I'd just agreed the memories were mine too. I was brought in by ambulance after what the paramedics described as a dissociative fugue state. I'd been found sitting on a bench outside a library I didn't recognize, holding a book I didn't remember checking out. The title was something about migratory birds. I don't have any interest in birds. I don't have a library card. When the EMTs arrived, they asked my name, my address, my date of birth. I answered correctly. They asked if I knew what day it was. I didn't. They asked if I'd taken anything. I said no. They asked if I wanted to go to the hospital. I said I didn't know. They brought me anyway. The emergency room was loud and fluorescent. A nurse took my vitals and asked standard questions. Allergies. Medications, emergency contacts. I gave her my brother's number. She asked if there was anyone else. I said no. She made a note and said a psychiatrist would be by to evaluate me. I asked how long that would take. She said it depended on the shift. I waited for 4 hours. Dr. Parnell arrived just after midnight. She was in her 50s with short gray hair and an expression that suggested she'd worked too many overnight shifts. She asked me to describe what happened. I told her I didn't remember. She asked what the last thing I did remember was. I said I was at home making dinner. She asked what I was making. I said pasta. She asked if I finished cooking it. I said I didn't know. She made a note and said I'd be admitted for observation. I asked for how long. She said 72 hours minimum. I asked if I could refuse. She said I could, but it wasn't advisable. I agreed. The intake process took another hour. A coordinator named Bryce walked me through the paperwork. He cataloged my belongings one by one, reading each item aloud before placing it in a plastic bin. Wallet, black leather, contains driver's license, debit card, $23 cash. I nodded. Phone, silver case, passcode protected. I nodded. Keys, ring with 4 keys attached. I nodded. Wedding ring, gold band, engraved interior. I said, I don't have a wedding ring. He looked up from the clipboard. You were wearing it when you arrived. I said, no, I wasn't. He set the clipboard down and reached into the bin. He pulled out a small plastic bag. Inside was a gold ring. He held it up to the light. See? Engraved. Says always. I stared at it. I'd never seen it before. I said, that's not mine. He checked the intake sheet. Says here you handed it to the EMT. Said you didn't want to lose it. I said, I don't remember that. He said, you signed the inventory list. I said, I didn't know what I was signing. He said, Kulumu, do you want me to remove it from the list? I hesitated. If it wasn't mine, where did it come from? If it was mine, why didn't I remember it? I said, oh, can I see it? He handed me the bag. I held it up and looked at the engraving. The word always was etched in delicate script. I turned it over. On the outside, there was a small scratch near the band, the kind that comes from years of wear. I didn't recognize it, but I also couldn't explain why it had been in my possession. I handed it back. I don't know where that came from. Bryce made a note. I'll put it in the inventory as disputed. You can sort it out when you're discharged. He moved on to the next item. Book, hardcover. The Migrations of North American Wading Birds. I said, that's not mine either. He said, you were holding it when the EMTs found you. I said, I was sitting outside a library. I probably picked it up by accident. He said, Luno, the library says you checked it out 3 weeks ago. I said, I don't have a library card. He pulled a card from the bin. It had my name on it. My photo. An issue date from 4 months earlier. I said, I've never seen that before. He said, it was in your wallet. I said, check my wallet. I'll prove it. He reached into the bin and opened my wallet. He pulled out the same card. He held it next to the one he'd just shown me. Identical. I didn't say anything. He continued with the inventory. Notebook, spiral bound. 32 pages of handwritten entries. He flipped it open and read aloud. March 4th, appointment at 9 a.m., discussed medication adjustment, feeling stable. March 11th, missed the exit again, ended up by the water. March 18th, she said I need to stop forgetting. I'm trying. I said, I didn't write that. He said, it's your handwriting. I said, how do you know? He compared it to the intake signature. It matched. I said, I don't keep a notebook. He said, it was in your jacket pocket. I said, I don't remember writing any of that. He made another note. I'll add it to the disputed list. He continued. Prescription bottle, sertraline, 50 milligrams, prescribed by Dr. Aldrich, 12 pills remaining. I said, I'm not on sertraline. He said, the label has your name. I said, I take escitalopram. He checked the bottle. He pulled a second bottle from the bin. You have both. I said, that's not possible. He said, they were both in your jacket. I didn't respond. He finished the list. Photograph, 4x6, 2 individuals inscribed on the back, us June 10th. He turned it over and showed it to me. I recognized myself in the photo. I was standing next to a woman I'd never seen before. We were smiling. My arm was around her. She was wearing the ring. I said, I don't know who that is. He said, she's listed as your emergency contact. I said, "My brother is my emergency contact." He checked the form. "You listed both. Her name is Claire. You gave her number." I said, "I don't know anyone named Claire." He said, "Do you want me to call her?" I said, "No." He set the photo aside and handed me the clipboard. "Sign here to confirm the inventory." I looked at the list. 13 items. 7 of them I didn't recognize, but the handwriting matched. The signature matched. The photo showed my face. I signed. That was 6 days ago. Since then, I've been trying to understand where those items came from. I asked the staff if there had been a mix-up during intake. They said no. I asked if someone else could have planted them on me. They said that was unlikely. I asked if I could see the security footage from the ER. They said it wasn't part of my treatment. Dr. Parnell came by on the 3rd day. She asked if I'd had any memory of the missing time. I said no. She asked if I recognized any of the items in my personal effects. I said no. She asked if I'd ever experienced gaps in memory before. I said no. She made a note and said they'd be running more tests. On the 5th day, a social worker named Monica came to my room. She asked if I wanted to contact Claire. I said I didn't know who Claire was. She said Claire had been calling every day asking about my condition. I asked what she'd been told. Monica said Claire was listed as my spouse. I said I wasn't married. Monica showed me the intake form. Under marital status, I'd written married. I said I didn't write that. She said, "It's your handwriting." I said, "I'm not married." She said, "Would you like to speak to her?" I said no. She left the phone number on my desk. I haven't called, but I've been thinking about the ring, about the notebook, about the photo. I've been trying to piece together a version of my life where those things make sense. A version where I checked out a book about birds, where I kept a journal, where I married someone named Claire. But I can't. This morning, Dr. Parnell returned. She said they'd reviewed my medical history. She said I'd been treated here before. I said I hadn't. She showed me a record, 3 prior admissions, same symptoms, same dissociative episodes, same disputed personal effects. I asked to see the records. She said they were part of my file. I asked why I didn't remember them. She said memory loss was common with dissociative disorders. I asked if I'd disputed the items during those admissions. She said yes. I asked what happened. She said eventually I'd accepted them. I asked why. She said because they were mine. I don't know what to believe anymore. I've been staring at the inventory list for hours, trying to remember. Trying to find some thread that connects me to those objects. But there's nothing. Just a ring I never wore. A book I never read. A face I never knew. And the worst part is I'm starting to recognize the handwriting in the notebook, not because I remember writing it, but because I've been writing in this room. On scraps of paper in margins, and it looks the same. I think the inventory was never wrong. I think I was. Some belongings don't come with you. They come for you, and eventually you remember why they were always yours. Story 5. Medication Adjustment Trial. The first change was subtle. I noticed my thoughts slowing down, becoming more deliberate, as if they were being vetted before I could access them. The psychiatrist, Dr. Hess, called it perceptual stabilization. He said the new regimen was designed to reduce intrusive ideation and improve cognitive coherence. I told him it felt like I was thinking through fog. He said the fog would clear once my brain adjusted to the new baseline. I asked how long that would take. He said it varied. The next morning I woke knowing exactly what I was going to say before I said it. Not because I'd planned it, because I'd already heard myself say it. Dr. Hess said that was expected. He increased the dosage. By the end of the week, I realized the side effects had been listed in the trial report, a report dated 3 days before I'd started experiencing them. I was recruited for the trial during my 3rd week on the ward. My primary diagnosis was generalized anxiety disorder with obsessive features. Standard treatment wasn't working. I'd tried 4 different SSRIs over 2 years, none of which significantly reduced the intrusive thoughts that looped endlessly through my mind. Dr. Hess approached me during a routine evaluation and asked if I'd be interested in participating in a clinical trial for a new pharmacological intervention. He said the medication was designed to interrupt maladaptive thought patterns at the neurological level. I asked if it was FDA approved. He said it was in phase 3 trials. I asked about side effects. He said they were generally mild and closely monitored. I asked if I could opt out if it didn't work. He said yes. I agreed because I didn't see another option. The trial began the following Monday. I was moved to a private room on the research wing. It was larger than my previous room, with better lighting and a window that actually opened. A nurse named Owen came by every morning at 8 a.m. to administer the medication and record my vitals. The pills were small and white, unmarked except for a faint HX stamped on one side. Owen logged the dosage in a tablet and asked a series of standard questions. How was I feeling? Was I experiencing any discomfort, any changes in mood or perception? I answered honestly. Fine. No. The first 3 days were uneventful. I felt slightly drowsy in the afternoons, but nothing alarming. My thoughts remained as intrusive as they'd always been, circling the same anxieties with the same relentless momentum. I reported this to Dr. Hess during our first check-in. He said the medication needed time to reach therapeutic levels. He said I should notice changes within the week. On the 4th day, I woke with a strange sensation. It was as if my thoughts were arriving a fraction of a second late, like dialogue in a poorly dubbed film. I would think something, I should get out of bed, and then I would hear the thought again, echoing in my mind as if I'd said it aloud. I mentioned it to Owen during the morning check-in. He made a note and said it was likely an adjustment phase. I asked if it was a known side effect. He said he'd check with Dr. Hess. That afternoon, Dr. Hess came by. He asked me to describe the sensation in detail. I told him it felt like my thoughts were being replayed. He nodded and said, "That's perceptual lag. It's a temporary effect as your neural pathways reorganize. It should resolve within a few days." I asked if other participants had experienced it. He said yes. I asked how many. He didn't answer directly, he just increased the dosage. By the 6th day, the lag had intensified. I would think something and then I would hear it. Not as an echo, but as a fully formed sentence spoken in my own voice before I'd consciously completed the thought. It was disorienting. I began second-guessing whether I was thinking things or remembering having thought them. I told Owen I wanted to reduce the dosage. He said I'd need to discuss it with Dr. Hess. I asked when I could speak to him. Owen said he'd be by later that day. Dr. Hess didn't come until the following morning. By then, the experience had shifted again. I was no longer hearing my thoughts after I had them. I was hearing them before. I would sit in silence, and a thought would arrive, clear, distinct, fully articulated, and a moment later, I would recognize it as something I was about to think. I told Dr. Hess this was unbearable. He said it was a sign the medication was working. I asked how anticipating my own thoughts could be therapeutic. He said, "You're developing insight into your cognitive processes. That's the goal. You're becoming aware of the patterns before they fully form." I said it doesn't feel like awareness. It feels like I'm not in control. He said a control is a subjective experience. What you're feeling is a recalibration. I asked him to stop the trial. He said we were only a week in. He said discontinuing prematurely would compromise the data. I asked if the data was more important than my well-being. He said the trial was designed to improve my well-being. He adjusted the dosage again. This time, he added a secondary medication to smooth the transition. The secondary medication made everything worse. The thoughts didn't just precede me, they bypassed me entirely. I would sit in my room and sentences would appear in my mind, fully formed as if I were reading them off a script. I would recognize them as mine, my syntax, my concerns, my anxieties, but I hadn't generated them. They were just there, waiting. I started writing them down to prove to myself I wasn't imagining it. I filled 3 pages in an hour. Owen collected them during his evening round. He said Dr. Hess wanted to review them. The next day, Dr. Hess returned with a printed report. He said my descriptions of cognitive anticipation were consistent with the trial's expected outcomes. I asked what that meant. He said the medication was successfully interrupting maladaptive loops by allowing my brain to preview and discard intrusive thoughts before they became distressing. I said it wasn't working. I said I was more distressed than I'd been before the trial started. He made a note and said, "Distress is often heightened during the adjustment phase. It will subside." I asked to see the report. He hesitated, then handed it to me. It was dated 5 days earlier. I checked the date again. The report included my descriptions of cognitive anticipation, the exact phrases I'd written in my journal the night before, but the report had been generated before I'd written them. I said, how is this possible? He said, tomorrow we use predictive modeling based on prior participant data. I said, this isn't modeling. This is exactly what I wrote. He said, predictive modeling can be highly accurate. I said, you're telling me you predicted I would write these exact sentences? He said, in a manner of speaking, yes. I didn't respond. He collected the report and left. I stopped trusting my thoughts after that. I would sit in my room and wait for sentences to arrive, and when they did, I would try to trace where they came from. Were they mine? Were they predictions? Were they implanted? I couldn't tell anymore. The boundary between generating a thought and receiving one had dissolved entirely. Owen continued the daily check-ins. He asked the same questions. I gave the same answers. But I started noticing something. He would ask, any changes in mood or perception? And I would open my mouth to answer, and he would already be making a note before I spoke. I asked him why he was writing before I responded. He said he was time-stamping the question. I asked to see the notes. He said they were part of the trial data and not accessible to participants. On the 12th day, I experienced something I can't adequately describe. I was sitting on the edge of my bed staring at the wall when I felt a thought begin to form. But before it could complete, I heard it, not in my mind, but aloud. My own voice speaking from somewhere behind me. I turned. The room was empty. I looked at the intercom panel on the wall. It was off. I looked at the door. It was closed. I stood and walked to the center of the room. I said, "Hello?" My voice came back, not as an echo, but as a continuation. It said, "You're not supposed to answer." I told Owen. I told Dr. Hess. I told everyone who would listen. They said it was an auditory hallucination, a known side effect. I said it wasn't a hallucination. I said I heard my own voice say something I hadn't thought yet. Dr. Hess said that was the definition of a hallucination. I asked him to review the recordings from my room. He said there were no recordings. I said the intercom was always active. He said it was only active during emergencies. I asked to leave the trial. He said I'd signed a consent form agreeing to complete the full protocol. I said I was withdrawing consent. He said I could, but it would require a psychiatric evaluation to determine if I was capable of making that decision. I asked when the evaluation would happen. He said within 72 hours. The evaluation never came. Instead, Dr. Hess returned with a revised consent form. He said the trial had been extended to include a secondary observation phase. He said my reactions were within expected parameters. I asked what that meant. He said it meant I was responding as predicted. I asked if the other participants were experiencing the same things. He said they did. I said, did? Past tense? He said, the trial concluded for them. You're the final participant. I asked when my trial would conclude. He said, when the data is complete. I'm still here. The medication continues. The thoughts still arrive before I think them. Sometimes I hear my own voice. Sometimes I read my own thoughts in the daily reports before I've written them. Owen still asks the same questions. I still give the same answers. Dr. Hess still says it's working. But I found something yesterday. A report left on the desk in my room. It was dated 2 weeks from now. It described the conclusion of my trial. It said I had successfully adapted to the cognitive intervention. It said my thoughts had stabilized. It said I had achieved full perceptual coherence. It was signed by me. I think the trial never intended to stop my thoughts. It intended to let me know what I'd think before I could choose not to. Some treatments don't fix you. They just show you who you'll become whether you agree or not. Story 6. Privileges revoked. The announcement came during morning rounds. Holly, one of the senior nurses, read from a tablet while standing just outside my door. Patient 6921. All movement privileges suspended pending behavioral review. I asked what I'd done. She said the infraction was noted in my chart. I asked to see it. She said that wasn't part of protocol. I asked when the review would happen. She said it depended on the treatment team's availability. I asked how long I'd be confined. She didn't answer. She just updated the whiteboard in my room to reflect the new status and left. The door locked behind her. I sat on the bed and tried to remember what I could have possibly done. I hadn't left my room. I hadn't spoken to anyone. I hadn't violated a single rule, and yet somehow I was being punished for something I couldn't name. I'd been on the ward for 5 weeks. I was originally admitted following what my outpatient psychiatrist described as a major depressive episode with marked isolation. I'd stopped going to work, stopped answering my phone, stopped opening my blinds. My landlord found me after I hadn't paid rent for 2 months. I don't remember much of that period. Just the feeling of being submerged, of wanting to stay submerged. My psychiatrist recommended inpatient stabilization. I agreed because I didn't have the energy to refuse. The first few weeks were structured but tolerable. I attended group therapy twice a week. I met with Dr. Oakes, my attending psychiatrist, every 3 days. I had privileges, supervised access to the courtyard, use of the common area, phone calls twice a week. I followed every rule. I took my medication on time. I participated when asked. I kept my space clean. I didn't cause problems. I thought I was doing well. Then the privileges were revoked. The morning it happened, I'd been sitting in the common area reading a magazine. Another patient, a man named Grant, had been watching television. A third patient, a woman whose name I didn't know, had been staring out the window. We weren't talking. We weren't interacting. We were just existing in the same space. Holly had walked past, glanced at us, and continued down the hall. 15 minutes later, she returned and told me to go back to my room. I asked why. She said it would be explained during rounds. When she made the announcement, I was too stunned to respond immediately. I asked again what I'd done. She repeated that it was in my chart. I asked if I could appeal. She said I could submit a request, but the suspension would remain in effect until the review was complete. I asked how long reviews typically took. She said it varied. I asked if there was someone else I could speak to. She said Dr. Oakes would address it during our next session. I asked when that would be. She said it hadn't been scheduled yet. I spent the rest of the day in my room trying to make sense of it. I replayed the morning in my mind. I hadn't said anything inappropriate. I hadn't acted out. I hadn't even made eye contact with the other patients. I'd just been sitting there, reading, quiet, compliant. Dr. Oakes came by the following afternoon. He sat in the chair by the door and opened a folder. I asked him why my privileges had been revoked. He flipped through several pages, then looked up. "It says here you violated the behavioral contract." I said, "What behavioral contract?" He turned the folder toward me. There was a document dated 2 weeks earlier, signed at the bottom. My signature. The contract outlined a series of expectations: compliance with treatment, respectful interaction with staff, adherence to scheduled activities, and maintenance of appropriate boundaries with other patients. Violations would result in suspension of privileges. I said, "I didn't sign this." He said, "It's your signature." I looked at it. It did look like mine, but I had no memory of signing it. I said, "I don't remember this." He said, "It was reviewed with you during intake to the privileges program." I said, "I was never in a privileges program." He made a note. "Do you recall meeting with Holly 2 weeks ago to discuss your progress?" I said, "Yes, but she didn't mention a contract." He said, "It's standard procedure. You would have signed it then." I said, "Even if I did, I didn't violate it. I haven't done anything." He said, "The infraction is documented." I said, "What infraction?" He flipped to another page. "Failure to maintain appropriate boundaries with other patients." I said, "I haven't interacted with anyone." He said, "On the morning of the incident, you were observed in close proximity to another patient in the common area." I said, "I was sitting across the room from Grant. We didn't even speak." He said, "Proximity is considered a boundary issue under the contract." I said, "Well, that's not reasonable." He made another note. "The treatment team determined that your lack of awareness regarding boundaries suggests a need for closer supervision." I said, "I wasn't unaware. I was sitting in a common area. That's what it's for." He said, "The interpretation of the contract is at the discretion of the team." I asked how long the suspension would last. He said it would be reassessed after I demonstrated consistent compliance. I asked how I could demonstrate compliance if I wasn't allowed to leave my room. He said that was something I'd need to work on. I asked if I could file an appeal. He said I could, but it would need to go through the proper channels. I asked what those channels were. He said Holly could provide the necessary forms. I asked when. He said when she had time. Holly came by the next morning with breakfast. I asked for the appeal forms. She said she'd bring them later. I asked when. She said when she had time. I asked if I could at least make a phone call. She said phone privileges were part of the suspension. I asked if I could send a message to my emergency contact. She said outside communication was restricted during behavioral reviews. I asked how long the review would take. She said it hadn't been scheduled yet. I filed the appeal 3 days later. Holly brought the form and I filled it out at the desk in my room. I described what had happened. I explained that I hadn't violated any rule. I requested a meeting with the treatment team to discuss the suspension. I signed and dated the form. Holly collected it and said it would be processed within 5 business days. A week passed, no response. I asked Holly if there was an update. She said the appeal was being reviewed. I asked by whom. She said the treatment team. I asked when I'd hear back. She said when the review was complete. Dr. Oakes returned 10 days after the suspension began. I asked if he'd reviewed my appeal. He said he had. I asked what the decision was. He said the suspension would remain in effect. I asked why. He said the treatment team had identified additional concerns. I asked what concerns. He opened the folder and read, "Patient exhibits defensive behavior when questioned about rule violations. Patient demonstrates limited insight into boundary issues. Patient continues to challenge staff decisions, suggesting resistance to treatment." I said, "I challenged the decision because it was unfair." He said, "Perceived fairness is subjective. The team's assessment is based on clinical observations." I said, "What observations? I've been in my room for 10 days. He said, "Your behavior during this period has been noted." I said, "What behavior?" He said, "You've submitted multiple requests for information. You've questioned staff repeatedly. You've expressed dissatisfaction with the treatment process." I said, "Because I don't understand why I'm being punished." He said, "This isn't punishment. It's a therapeutic intervention." I asked what the intervention was meant to address. He said, "Your difficulty accepting limits." I said, "I accept limits. I just want to know what I did wrong." He made a note. "This conversation will be included in your chart as evidence of ongoing resistance." I stopped asking questions after that. I stopped requesting updates. I stopped filing appeals. I thought if I complied silently, the suspension would be lifted, but it wasn't. Days turned into weeks. Holly continued to bring meals and collect trays. Dr. Oakes continued to visit and make notes. No one mentioned the review. No one mentioned the contract. No one mentioned when or if I would regain privileges. I started noticing entries in my chart that didn't match reality. During one of Dr. Oakes' visits, he referenced an incident where I'd allegedly raised my voice at a staff member. I told him that never happened. He said it was documented. I asked when it occurred. He said 3 days earlier. I told him I hadn't spoken to anyone in 3 days. He said the note was time-stamped. I asked to see it. He said that wasn't part of protocol. Another entry claimed I'd been non-compliant with medication. I told Holly I'd taken every dose on time. She said the records indicated otherwise. I asked her to check the logs. She said the logs were accurate. I asked how I could prove I'd taken the medication. She said I couldn't. A third entry described me as increasingly withdrawn and uncooperative. I told Dr. Oakes I was withdrawn because I wasn't allowed to leave my room. He said the withdrawal had been observed before the suspension. I said that wasn't true. He said the chart reflected a pattern. I asked what pattern. He said a pattern of non-compliance, resistance, and boundary violations. I asked how long this would continue. He said that was up to me. I asked what I needed to do. He said, "Accept the limits that have been set for you." I said, "I do accept them." He said, "Your words suggest otherwise." I said, "What do you want me to say?" He said, "That's not for me to decide. I'm still here. The suspension is still in effect." I don't ask questions anymore. I don't file appeals. I don't speak unless spoken to. I sit in my room and wait for meals and take my medication and stare at the whiteboard that lists my restrictions. The list grows longer each week. New rules I didn't know existed. New violations I didn't commit. New evidence that I'm not improving. I think the privileges were never about freedom. They were about having something to take away. And once they're gone, the only thing left is compliance. Some rules exist to be broken. Others exist to prove you never had a choice. Story 7. Sleeproom Protocol. The lights dimmed at 9 p.m. every night. The nurse, a man named Eric, told me it was to encourage natural sleep rhythms. He said the room was designed for patients with severe insomnia. Soundproofed, climate-controlled with blackout shades that sealed completely. He said most patients adapted within 72 hours. I told him I'd never had trouble sleeping at home. He said that was common. He said the stress of hospitalization often disrupted established patterns. He assured me the protocol had a high success rate. I asked what the protocol involved. He said rest, observation, adjustment. I asked if I'd be monitored overnight. He said no one would enter unless there was an emergency. I asked how they'd know if there was an emergency. He smiled and said they'd know. The door closed, the lights dimmed, and when I woke in the morning, the observation log had already been updated. It was signed in handwriting that looked exactly like mine. I was transferred to the sleep room during my 4th week on the ward. My primary diagnosis was major depressive disorder with marked insomnia. I hadn't slept more than 2 hours a night in over a month. My outpatient psychiatrist tried medication, trazodone, mirtazapine, quetiapine, but nothing worked. I would lie in bed until 4 or 5 in the morning, my mind cycling through the same anxious loops. And then I'd fall asleep just before dawn. When I was admitted, Dr. Lang said they had a specialized program for treatment-resistant insomnia. He said the sleep room had been designed to eliminate external disruptions and create an optimal environment for rest. I asked if it was experimental. He said it was evidence-based. I asked if I had a choice. He said I could decline, but my discharge would be delayed until the insomnia was resolved. I agreed. The sleep room was on the 2nd floor at the end of a hallway I hadn't been to before. It was larger than my previous room, with a hospital bed in the center, a padded chair in the corner, and a small desk with a lamp. The walls were a soft gray. The floor was carpeted. There were no windows. Eric showed me the controls for the lighting, a dimmer switch near the door that adjusted the overhead panel from full brightness to a faint amber glow. He explained the schedule. Lights at full brightness from 6 a.m. to 9 p.m., gradual dimming from 9 p.m. to 10 p.m., complete darkness from 10 p.m. to 6 a.m. He said I'd have access to the bathroom across the hall during waking hours. He said meals would be brought at standard times. He said I was encouraged to stay in bed as much as possible to reinforce the sleep association. I asked if someone would be checking on me overnight. He said no. He said the room was monitored remotely, but no one would enter unless I used the call button. I asked what remote monitoring meant. He said sensors tracked movement and vitals. I asked if there were cameras. He said no. I asked how they'd know if I was sleeping. He said the sensors provided sufficient data. I asked if I could keep the light on. He said the protocol required adherence to the schedule for maximum effectiveness. I asked what happened if I couldn't sleep. He said that was expected initially. He said the goal wasn't to force sleep, but to create the conditions for it. I asked how long I'd be in the sleep room. He said most patients graduated after 1 to 2 weeks. I asked what graduation meant. He said it meant stable sleep patterns. I asked how that was measured. He said they'd review the logs. The first night I lay in bed and stared at the ceiling. The lights dimmed at 9 p.m., slowly fading over the course of an hour. By 10 p.m. the room was completely dark. I couldn't see my hand in front of my face. The silence was absolute. No hum of ventilation, no distant voices, no footsteps in the hallway, just silence and darkness. I closed my eyes and tried to sleep. My mind wouldn't stop. I thought about work, about bills, about the friend I hadn't called back, about the fact that I was lying in a hospital room specifically designed to make me sleep and I still couldn't. I checked the time on the digital clock near the bed. 11:47 p.m. I closed my eyes again. 12:31 a.m., 1:53 a.m., 3:18 a.m. At some point I must have fallen asleep because I woke to the lights gradually brightening. The clock read 6 a.m. Eric came by at 7 a.m. with breakfast. He asked how I'd slept. I told him maybe 2 hours. He made a note on his tablet and said that was normal for the first night. He asked if I'd experienced any discomfort. I said no, just frustration. He said frustration was common. He said the protocol took time. He collected the tray and said he'd check in again at lunch. After he left, I noticed a clipboard hanging on the wall near the door. It held a single sheet of paper with a table labeled Sleep Observation Log. There were columns for date, time asleep, time awake, total sleep duration, and notes. The first row had been filled in. Date, the current date. Time asleep, 3:42 a.m. Time awake, 5:58 a.m. Total sleep duration, 2 hours, 16 minutes. Notes, patient appears restful, no distress observed. I stared at it. I didn't remember falling asleep at 3:42 a.m. I didn't remember waking at 5:58 a.m. I'd glanced at the clock at 3:18 a.m., and the next thing I knew it was 6 a.m. and the lights were coming on. But the log was specific, precise. I assumed the sensors must have recorded it. I left it alone. The second night was the same. I lay in the dark and tried to sleep. I counted breaths. I relaxed my muscles one by one. I tried not to think. The clock moved slowly. 11 p.m., midnight, 1 a.m., 2 a.m., and then I woke to the lights brightening at 6 a.m. Eric returned with breakfast. He asked how I'd slept. I said I still didn't think I'd slept much. He checked his tablet and said the log showed improvement. I asked what the log said. He turned the screen toward me. Time asleep, 2:51 a.m. Time awake, 6 a.m. Total sleep duration, 3 hours, 9 minutes. Notes, patient restful. Vital signs stable. I said, I don't think I slept for 3 hours. He said, the sensors are very accurate. I said, Tormo, I remember looking at the clock at 2:15. I don't remember falling asleep after that. He said, that's normal. Most people don't remember the exact moment they fall asleep. I said, Wambudu, but I didn't feel like I slept. He said, perception of sleep can be distorted, especially when you're anxious about it. The objective data is more reliable. I asked if I could see the raw data. He said it was part of my medical record and would be reviewed by Dr. Lang. I asked when I'd see Dr. Lang. He said during rounds later that week. The third night I decided to stay awake. I wanted to prove to myself that I wasn't sleeping. I sat up in bed and kept my eyes open. The lights dimmed. The room went dark. I focused on staying alert. I counted seconds. I recited song lyrics in my head. I shifted positions every few minutes to avoid getting too comfortable. I checked the clock obsessively. 10:30 p.m., 11 p.m., midnight, 1 a.m., 2 a.m., 3 a.m., 4 a.m., 5 a.m. At 6 a.m., the lights came on. I felt exhausted but certain I hadn't slept. Eric arrived with breakfast. He asked how I'd slept. I said I hadn't. I told him I'd stayed awake the entire night. He checked his tablet and frowned. He said the log indicated otherwise. I said the log was wrong. He showed me the screen. Time asleep, 11:34 p.m. Time awake, 5:41 a.m. Total sleep duration, 6 hours, 7 minutes. Notes, patient achieved full sleep cycle. Significant improvement. I said, and that's not possible, I was awake. He said, let's tell him the sensors are very precise. They track micro movements and brainwave activity. I said, I was sitting up. I was counting. I was checking the clock. He said, it's possible you experienced a dissociative state that felt like wakefulness but was actually light sleep. I said, I know the difference between being awake and being asleep. He made a note. I'll mention your concerns to Dr. Lang. Dr. Lang came by that afternoon. He asked how I was adjusting to the sleep room. I told him the logs were inaccurate. I told him I wasn't sleeping as much as the data suggested. He said the sensors were hospital grade and had been validated in multiple studies. I said I'd stayed awake the entire previous night and the log claimed I'd slept for 6 hours. He said perceptual distortions were common in patients with chronic insomnia. I said I wasn't distorting anything. He said the objective data had to take precedence over subjective reports. I asked if I could leave the sleep room. He said not until my sleep patterns stabilized. I asked how long that would take. He said it depended on my progress. The next morning, I noticed something else. The observation log had a new column, logged by. Next to the entry for the previous night, it read, Patient Self-Report. I looked at the handwriting in the notes section. It looked like mine. I asked Eric about it when he brought lunch. He said some patients were encouraged to participate in logging their own sleep as part of the therapeutic process. I said I hadn't written anything. He said it was in the protocol. I said I wanted to see the protocol. He said he'd check with Dr. Lang. I checked the log again that evening. The handwriting was mine. The signature at the bottom was mine. But I hadn't written it. I was certain. I stared at it for a long time, trying to make sense of it. Finally, I decided to stay up again. I would sit at the desk with the lamp on and write my own log. I would document every hour I was awake. I would prove the sensors were wrong. The lights dimmed at 9 p.m. I turned on the desk lamp. I sat down with a blank piece of paper and a pen I'd borrowed from Eric earlier in the day. I wrote, 10 p.m., awake, sitting at desk, no signs of sleep. I waited, 10:30 p.m. 10:30 p.m., awake, no fatigue. 11 p.m. 11 p.m., still awake, lamp on, writing continuously. I kept going. Every 30 minutes, I added a new entry. The page filled. I started a second page. At 6 a.m., the lights came on. I looked down at the desk. The paper was covered in writing, but the handwriting changed halfway through. The first page was mine. The second page looked like mine, but the sentences were different. They described me sleeping. 12:43 a.m., patient lying in bed, eyes closed, breathing regular. 2:15 a.m., patient in deep sleep, no movement. 4:30 a.m., patient restful, sleep cycle complete. I hadn't written those entries, I was certain, but they were in my handwriting, and they were signed at the bottom. Eric came by with breakfast. He said the log showed excellent progress. I didn't respond. I just handed him the papers. He glanced at them and smiled. See? You're sleeping better than you think. I stopped questioning it after that. I stopped trying to stay awake. I stopped checking the clock. I lay in bed every night and let the darkness take me. The logs continued to update. The handwriting continued to look like mine. Dr. Lang said I was ready to graduate. Eric said my sleep patterns had stabilized. I was discharged from the sleep room after 12 days. I returned to the main ward, but I kept thinking about the logs, about the handwriting, about the entries I didn't remember writing. I asked Dr. Lang if I could review them. He said they were part of my record and would be included in my discharge summary. When I finally saw the discharge summary, it included a note. Patient successfully completed sleep room protocol. Demonstrated ability to self-monitor and log sleep independently. Significant improvement in sleep hygiene and insight. I don't remember self-monitoring. I don't remember logging anything. But the records say I did, the handwriting says I did. And everyone agrees I slept. I think the room didn't teach me to sleep. It taught me that my memory of being awake doesn't matter if someone else writes that I was asleep. Some rest isn't given. It's documented, and once it's written, it becomes the only version that's real. Story 8. Discharge summary. The paperwork was on my desk when I woke. A folder with my name printed on the tab, thick with forms I didn't remember signing. The top sheet was titled Discharge Summary. I read through it carefully. It described symptoms I'd exhibited, treatments I'd received, progress I'd made. It listed medications I'd taken and groups I'd attended. It detailed conversations I'd had with staff, insights I'd gained, moments of crisis I'd navigated. All of it was thorough, all of it was documented, and none of it was mine. I looked at the signature line at the bottom. It was dated 3 days from now. And it was signed in my handwriting. The final line read, "Patient agrees to voluntary continuation of inpatient care pending further stabilization." I asked Dr. Voss about it during morning rounds. She said I'd consented to an extension during our last session. I told her we hadn't had a session. She opened her notes and showed me the entry. It was signed by both of us. I didn't remember signing it. She said that was expected. She said memory distortions were common at this stage. I asked what stage. She said the stage before discharge becomes voluntary admission. Then she closed the folder and left. I'd been on the ward for 8 weeks. My intake diagnosis was adjustment disorder following a significant life disruption. I'd lost my job, ended a long-term relationship, and moved to a city where I didn't know anyone. I wasn't suicidal. I wasn't psychotic, I was just overwhelmed. My primary care doctor referred me to outpatient therapy, but when I called the clinic, the wait time was 3 months. She suggested a brief inpatient stay to stabilize my mood and connect me with resources. She said it would be a week, maybe 2. I said yes because I didn't know what else to do. The first 2 weeks were structured but tolerable. I attended group therapy, met with a social worker named Andrea, and saw my psychiatrist, Dr. Voss, twice a week. The medication helped. The routine helped. I started feeling more stable. During my second meeting with Dr. Voss, I asked when I'd be discharged. She said discharge planning would begin once I demonstrated sustained improvement. I asked what that meant. She said it meant consistent mood stability, engagement in treatment, and a clear aftercare plan. I said I felt stable. She said that was good. She said we'd reassess in a week. A week later, I asked again. She said I was making progress but needed more time. I asked how much more time. She said it depended on my continued engagement. I asked what I needed to do. She said to keep attending groups and taking my medication. I said I was doing that. She said she knew. She said that's why I was improving. She didn't mention discharge again. By the 4th week, I started asking more directly. I told Andrea I wanted to leave. She said she understood. She said she'd discuss it with the treatment team. I asked when. She said during the next meeting. I asked when that was. She said Thursdays. I waited. After the meeting, she came to my room and said the team felt I needed a bit more time. I asked why. She said I was doing well, but they wanted to ensure the stability was sustainable. I asked how they'd determine that. She said by observing my continued progress. I asked if there was a timeline. She said timelines were difficult to predict. I asked if I could set a goal date. She said goals were important, but flexibility was also important. I asked what would happen if I demanded to leave. She said I'd entered voluntarily, so I could leave voluntarily, but she didn't recommend it. She said leaving prematurely could result in relapse. I asked what would happen if I relapsed. She said I might need to return. I asked if that would make the stay longer. She said possibly. I didn't ask again. By the 6th week, I stopped asking. I followed the schedule. I attended groups. I met with Dr. Voss. I took my medication. I waited. I thought if I demonstrated stability long enough, they'd have no reason to keep me. But the days continued, the meetings continued, and no one mentioned discharge. Then, during the 8th week, the folder appeared. It was on the desk in my room when I woke one morning. I hadn't heard anyone enter. The door had been closed, but the folder was there, labeled with my name. I opened it. The first document was the discharge summary. It was 5 pages long. It began with my intake information, name, date of birth, admission date, and then detailed my course of treatment. It described my initial presentation as emotionally dysregulated with marked depressive symptoms and passive suicidal ideation. I stopped. I read it again. I hadn't had suicidal ideation. I'd told them that during intake. I'd filled out the form. I'd checked no on every question about self-harm or suicidal thoughts. I kept reading. The summary described multiple incidents of increased agitation and resistance to treatment. It listed dates, specific times. It quoted things I'd allegedly said. "I don't need to be here. I should have been discharged weeks ago. No one is listening to me." I had said those things, but the summary framed them as evidence of impaired judgment and lack of insight. The next section detailed the medications I'd been prescribed. The list was longer than I remembered. Sertraline, quetiapine, lorazepam, hydroxyzine, trazodone. Some of them I recognized, others I didn't. I checked the dosages. Some were accurate, others were higher than what I'd been taking. I checked the dates. Some of the medications were listed as started before I'd arrived. The summary also described my participation in groups. It noted my attendance and engagement, but it included observations I didn't recognize. Patient often deflects when asked about emotional state. Patient demonstrates difficulty accepting feedback. Patient expresses frustration with pace of treatment, suggesting unrealistic expectations. I didn't remember being described that way. I didn't remember exhibiting those behaviors. The final section was labeled Discharge Plan, but instead of outlining steps for leaving, it detailed recommendations for continued care. It stated that I had agreed to extend my stay voluntarily. It said the extension was necessary to ensure sustained stabilization. It listed a series of goals I needed to meet before discharge could be reconsidered. Demonstrated medication compliance for a minimum of 4 additional weeks. Consistent engagement in group therapy with measurable improvement in insight. Development of a comprehensive aftercare plan including outpatient therapy and housing stability. At the bottom there was a signature line. It was dated 3 days from the current date. It was signed in handwriting that looked exactly like mine. Next to my signature was another line signed by Dr. Voss. I stared at it. I hadn't signed anything. I hadn't agreed to extend my stay. I hadn't consented to any of this. I brought the folder with me to my meeting with Dr. Voss that afternoon. I set it on the desk between us and said, "I didn't sign this." She opened the folder and glanced at the summary. "Yes, you did. We reviewed it together during our last session." I said, "We didn't have a session last week." She turned to a page in her own folder, a different one, thicker, with my name on the tab. She pointed to an entry dated 5 days earlier. It read, "Patient and clinician reviewed discharge summary. Patient expressed understanding of continued care needs and agreed to voluntary extension. Both parties signed consent." I said, "I don't remember that session." She said, "Memory lapses can occur, especially during periods of stress." I said, "I'm not stressed. I didn't sign that." She said, The signature is yours." I looked at it again. It did look like mine. The loops, the slant, the way the E in Evan connected to the V. But I didn't remember writing it. I said, "I want to leave." She said, "You're welcome to leave. But if you leave against medical advice, it will be noted in your record. It may affect your ability to access care in the future." I said, "I'm leaving voluntarily. I was admitted voluntarily." She said, "You were, but you also voluntarily agreed to extend your stay." I said, "I didn't." She closed the folder. "The documentation suggests otherwise." I asked to speak to Andrea. She came to my room an hour later. I showed her the discharge summary. I told her I hadn't signed it. She said it was in my file. I said I didn't care. I said I wanted to leave. She said she understood. She said she'd bring it up with the treatment team. I asked when they met. She said Thursdays. I said that was 2 days away. She said she'd see if they could discuss it sooner. Thursday came. Andrea returned and said the team had reviewed my request. She said they felt it was in my best interest to stay. I asked why. She said the summary outlined the reasons. I said the summary was inaccurate. She said the summary was based on clinical observations. I said I didn't agree with the observations. She said lack of insight was one of the concerns. I asked what that meant. She said it meant I wasn't fully aware of my condition. I said I was aware. She made a note. I stopped arguing. I started watching. I noticed the discharge summary had been updated. There was a new entry dated the day after my conversation with Dr. Voss. It read, "Patient expressed desire to leave AMA. Demonstrated poor insight into need for continued care. Team recommends extension of stay to address resistance and stabilize mood." I hadn't spoken to the team, but the entry was there, and it was signed. I found other documents in the folder, incident reports I didn't remember, medication logs that listed doses I didn't recall taking, therapy notes that described sessions I didn't remember attending. All of them were signed. All of them were dated. All of them looked official. I asked Dr. Voss if I could see my full medical record. She said I could request it, but it would take time to process. I asked how much time. She said several weeks. I asked if I'd still be here in several weeks. She said that depended on my progress. I tried calling my primary care doctor. Phone privileges were restricted. I tried writing a letter. Outgoing mail required staff approval. I tried contacting my brother. Andrea said she'd pass along the message. He never called. I'm still here. The discharge summary is still in the folder. The signature is still at the bottom. The date keeps changing. Every few days, a new version appears. The goals shift. The timeline extends. The observations accumulate. This morning, I found a new document. It was titled Voluntary Long-Term Admission Agreement. It stated that I had requested continued inpatient care due to ongoing instability. It said I recognized the need for extended support. It said I agreed to remain under the care of the treatment team until discharge criteria were met. It was signed, dated, notarized. I didn't request continued care. I didn't sign it, but it's in the folder. It's in my record. And according to everyone here, it's real. I think discharge was never the goal. I think the summary was written before I arrived, and every day I stay, they add another line, another signature. Another reason I agreed to remain. Some paperwork doesn't release you. It just documents the moment you stopped asking to leave. Story 9. The medication cart rounds. The cart arrived every morning at 7:45. Metal wheels on linoleum. The sound carried down the hallway before I saw it. They called my name. I walked to the door. The nurse handed me a small paper cup with 3 pills, one white, one yellow, one pale green. I swallowed them with water. She checked my mouth. She made a note. But this morning, when she called my name, I was already standing at the door. And when I looked at her tablet, my name had already been checked off. She handed me the cup anyway. I swallowed the pills. She checked my mouth again, then she moved to the next room and called my name a second time. I was admitted on November 8th for what the intake psychiatrist described as medication-resistant depression with moderate psychomotor retardation. I'd been through 4 different antidepressant trials over the previous year, none of which had produced meaningful improvement. My outpatient provider recommended inpatient care for intensive medication management and monitoring. I agreed. I thought closer supervision might help identify what would work. The ward operated on a strict medication schedule. Morning distribution occurred at 7:45, evening distribution at 7:45. The medication cart was wheeled room to room by a rotating staff of nurses. Each patient was called by name, handed their medications in a small paper cup, observed while swallowing, and checked for oral retention. The process was methodical and unchanging. My room was 4th on the route. I learned this during my first morning. I woke to the sound of the cart in the hallway. Metal wheels, a faint squeak, the rustling of the nurse's movements. I heard her call the first name. A door opened. A brief exchange. The door closed. The cart moved. Second name, third name, then mine. "Owen," the nurse called. I got out of bed and went to the door. I opened it. The nurse, her badge read Linda, stood beside the cart with a small paper cup in her hand. "Good morning, Owen. 3 medications this morning." She handed me the cup. Inside were 3 pills, 1 white, 1 yellow, 1 pale green. She handed me a second cup filled with water. I swallowed the pills. She leaned forward slightly. "Open, please." I opened my mouth. She checked under my tongue, along my gums. Satisfied, she made a note on her tablet and moved to the next room. The routine repeated that evening. Same cart, same sound, same sequence. My room was 4th. Linda called my name. I opened the door. She handed me the cup. 2 pills this time, 1 white, 1 pale green. I swallowed. She checked. She made a note. She moved on. By the 3rd day, I anticipated the cart before I heard it. I'd wake a few minutes before 7:45 and lie still, waiting for the sound. When it came, I'd get out of bed, walk to the door, and wait. By the time Linda called my name, I was already there. "You're prompt," she said on the 4th morning. "I hear the cart coming." She smiled and handed me the cup. The pills were always the same. Morning, white, yellow, pale green. Evening, white, pale green. I asked Linda what they were. "The white one is an SSRI, the yellow is a mood stabilizer, the green is for sleep." "Why do I take the sleep medication in the morning?" She checked her tablet. "It's low dose. It's meant to reduce anxiety throughout the day." I nodded. By the end of the 1st week, I noticed I felt calmer. Not dramatically different, but steadier. Less reactive. I mentioned it during my session with Dr. Marin, the attending psychiatrist. "That's encouraging," she said. "The regimen seems to be working. How long before we know for sure?" "Another week or 2. We'll monitor closely." I asked if the dosages might be adjusted. "Possibly. We'll see how you respond." By the 2nd week, I began to notice something unusual. I'd be lying in bed waiting for the cart, and I'd hear my name called, but the cart hadn't arrived yet. I'd get up, walk to the door, and open it. Linda wouldn't be there. I'd wait. A minute later, the cart would appear. Linda would call my name. I'd take the pills. I assumed I was misremembering the sequence. Sleep medication, even low dose, could cause mild confusion, but it happened again and again. On the 10th morning, I decided to test it. I stayed in bed after waking. I didn't move. I waited for the sound of the cart. At 7:43, I heard my name. "Owen." I sat up. The cart wasn't in the hallway yet. I could hear it 3 rooms away. I got out of bed and went to the door. I opened it. The hallway was empty. I waited. A minute later, the cart appeared. Linda rounded the corner. She stopped at my door. "Good morning, Owen." She handed me the cup. I took the pills. She checked my mouth. She made a note on her tablet. Then she frowned. "Did you already come to the door?" "Yes," I said. "Before I called you?" "I heard you call my name." She glanced at her tablet. "I just called it now." "I heard it earlier." She made another note. "Auditory distortions can be a side effect. I'll mention it to Dr. Marin." That afternoon, Dr. Marin asked me about it. "Linda said you've been hearing your name before the cart arrives." "Yes." "How often?" "The past few days." She made a note. "It's likely related to the sleep medication. We can adjust the dose if it's bothersome." "It's not bothersome, just confusing." "Confusion is worth addressing. Let's reduce the evening dose and monitor." The evening dose was reduced, but the phenomenon continued. On the 12th morning, I heard my name while I was still in bed. I didn't move. I listened. The cart was 2 rooms away. I heard Linda call another name, then mine. Owen. I got up and opened the door. Linda was at the 3rd room, not mine. I waited. She finished with that patient, moved the cart, and stopped at my door. "Good morning, Owen." She handed me the cup. I took the pills. She checked my mouth. Then she looked at her tablet and frowned. "You're already checked off." I stared at her. "What?" She turned the screen toward me. My name, Owen Trask, was listed 4th. Beside it was a check mark and a timestamp, 7:44 a.m. "But you just gave me the pills," I said. She looked at the cart, then at the tablet. "I must have marked you by mistake when I was at the previous room." "Is that possible?" "It shouldn't be. The system requires confirmation before checking." She manually unchecked the box, then checked it again. "There. Corrected." She moved to the next room. That evening, the same thing happened. I opened the door when Linda called my name. She handed me the cup. I swallowed the pills. She checked my mouth. Then she looked at the tablet. "You're already checked off again. Did you mark me early?" "No, I just arrived at your door." She showed me the screen. My name was checked. Timestamp, 7:43 p.m. "That was 2 minutes ago," I said. "I know." She unchecked and rechecked the box. She made a note. "I'm going to report this to IT. There might be a system glitch." By the 14th day, it happened every time. Morning and evening. I'd open the door, take the pills, and Linda would find my name already checked off. She stopped commenting on it. She'd just uncheck and recheck the box without explanation. On the 16th morning, I decided to watch the process. I opened the door before Linda arrived. I stood in the doorway and waited. The cart appeared. Linda stopped at the 3rd room. She called the patient's name. The door opened. She handed over the cup. The patient swallowed. She checked. She moved the cart toward my room. Before she reached me, I heard my name. "Owen." The voice came from behind me. I turned. My room was empty. I turned back. Linda was now at my door. "Good morning, Owen. Did you just call my name?" "Yes." "From inside my room?" She frowned. "No, from here." I took the pills. She checked my mouth. She looked at the tablet. "You're checked off. 7:44. She showed me the screen. Beside my name was a note. "Pills administered. Compliant. No issues." "I didn't take them yet," I said. "You just did." But the note was already there. She scrolled through the log. "It generates automatically when I check the box." "But you hadn't checked the box yet." She didn't respond. She unchecked and rechecked. She moved on. That afternoon, I asked Dr. Marin if the medication could cause time distortions. "What kind of distortions?" "Feeling like things are happening before they happen." She made a note. "That's unusual. Can you describe it more specifically?" I explained the cart, the check marks, the voice. She listened carefully. "It sounds like you're experiencing mild derealization, a sense that events are out of sequence." "Is that a side effect?" "It can be, especially with mood stabilizers." "Can we adjust it?" "Let's give it another week. If it persists, we'll consider changing the regimen." But it didn't persist. It escalated. On the 18th morning, I woke to the sound of my name. "Owen." I opened my eyes. The room was dim. I checked the clock. 7:32. The cart hadn't started rounds yet. I got out of bed and went to the door. I opened it. The hallway was empty. I stepped out. I walked toward the nurse's station. The cart was parked there, unattended. I returned to my room and waited. At 7:45, the cart began rounds. I heard Linda call the first name, then the second, then the third, then mine. I opened the door. Linda handed me the cup. I took the pills. She checked my mouth. She looked at the tablet. You're already checked off. 7:33. I stared at the screen. Timestamp 7:33 a.m. Note, pills administered. Compliant. No issues. I wasn't even at the door at 7:33, I said. The system says you were. Can you check the log? She scrolled back. It shows you received your medication 12 minutes ago. From who? She frowned. From me. You weren't here 12 minutes ago. She checked the schedule. I started rounds at 7:45. Then how did I receive medication at 7:33? She didn't answer. She made a note and moved on. That evening, I stayed in bed when the cart arrived. I didn't go to the door. I heard Linda call the first name, then the second, then the third, then mine. Owen? I didn't move. I waited. A minute passed. Linda knocked on my door. Owen, medication time. I got up and opened the door. I called you a minute ago, she said. I know. I wanted to see what would happen if I didn't come. She handed me the cup. I took the pills. She checked my mouth. She looked at the tablet and sighed. You're already checked off. 7:46. What time is it now? 7:47. So I took the pills a minute ago? According to this, yes. But I didn't come to the door until now. She made a note. I'm escalating this to the supervisor. The next morning, a different nurse arrived with the cart. Her badge read Patricia. She called my name. I opened the door. Good morning, Owen. Linda's off today. I'll be doing rounds. She handed me the cup. I took the pills. She checked my mouth. She looked at the tablet. You're already checked off. I wasn't surprised. She frowned. Did someone else give you medication this morning? No. The log shows you received it at 7:38. I've been in my room since 7. She scrolled through the log. It says you were compliant. No issues. Who administered it? She checked the signature field. Linda. Linda's off today. I know. She made a note. She moved on. That afternoon, I asked to see the medication log for the past week. Dr. Marin approved the request. A nurse printed it and handed it to me. I read through it carefully. Each entry was identical. Time 7:44 to 7:47 a.m. Administered by Linda. Patient status compliant, no issues. But beside each entry was a second timestamp, earlier by 10 to 15 minutes with the same note. Pills administered. Compliant, no issues. I showed it to Dr. Marin during our session. There are 2 entries for every dose, I said. She reviewed the log. That's unusual. One entry is when I actually take the pills, the other is earlier. Do you remember taking the pills twice? No. Just once. She made a note. I'll have the pharmacy review the log. The pharmacy found no discrepancies. They said the log was accurate. On the 21st morning, I heard my name while I was in the bathroom. I walked out. The door to my room was open. Linda stood in the hallway. There you are, she said. I called you. I was in the bathroom. She handed me the cup. I took the pills. She checked my mouth. She looked at the tablet. You're already checked off. 7:41. I looked at the clock on the wall. 7:45. That was 4 minutes ago, I said. I know. Was I at the door 4 minutes ago? She glanced at the log. According to this, yes. But I was in the bathroom. She made a note. She moved on. That evening, I stood in the hallway and waited for the cart. I watched Linda complete the 3rd room. She moved the cart toward me. Before she reached my door, I heard my name from inside my room. Owen. I turned. Through the door window, I saw someone standing beside my bed. The figure was facing away. But I recognized the build, the posture. It looked like me. Linda reached my door. Good morning, Owen. I turned back. She handed me the cup. I took the pills. She checked my mouth. She looked at the tablet. "You're already checked off." I looked through the window. The figure was gone. This morning, I didn't go to the door when Linda called. I stayed in bed. I heard her knock. I didn't respond. After a minute, she opened the door and stepped inside. "Owen, are you all right?" I sat up. I'm fine. It's medication time." "I know." She handed me the cup. I took the pills. She checked my mouth. She looked at the tablet and frowned. "You're checked off. 7:42. What time is it now?" 7:46. "So I already took the pills 4 minutes ago?" "According to the log, yes. Then why did you just give them to me?" She didn't answer. She made a note. She left. Tonight I'm writing this because I found something in the medication log. I requested another copy this afternoon. I read through every entry for the past 3 weeks. The timestamps are always early, 10 to 15 minutes before the card arrives. And every entry lists the same administrator, Linda. But beside each early entry is a second note I hadn't noticed before. Patient self-administered under observation protocol. I never self-administered. I don't have access to the medication card, but the log says I did. And the signature beside each entry is mine. Some pills aren't given. They're taken before you're offered them, and by the time you swallow what's in your hand, you've already agreed to take what comes next.